excited to have you on to talk about anemia today. And as a fibroid doc, I take care of a lot of patients with fibroids and bleeding, heavy periods. And so we're always talking about anemia, I feel like. So tell us a little bit about yourself, who you are and what you do. Like you're a hematologist. What does that mean? So if you can tell us a little bit more about yourself, that would be
Absolutely.
great.
Thank you, Dr. Cheruba. So I'm Toyosi Onwuemene. I'm a hematologist, and that means I take care of patients with blood disorders. And that's all sorts of blood disorders that affect the red blood cells, like anemia, blood disorders that affect the white blood cells, like when the white blood cells are high, but not cancer, and then also blood disorders that affect the platelets, so bleeding and clotting as well. Definitely anemia is by far and large the most important thing that we see by the numbers. And 50% of the population tends to deal with anemia at least at some point in their lives. And so anemia is a really important topic. Thank you for having me on to talk about it.
Yeah, absolutely. So, as a hematologist, now you do, obviously you go to medical school, then you do your residency, and then you have an additional specialty, right? Like you spend more time training in just this specialty. And so you're like the specialist for patients who have anemia, who can't quite seem to get that under control. I know a lot of patients have not even heard of that word hematologist. So I really thought it was very important to explain that a little bit. And I didn't realize that 50% of the population dealt with anemia at some point or the other. So that's quite a big number. So can you tell us a little bit about, what
Very
exactly
good.
is
Yes, thank you
anemia?
for asking that. So to speak about the 50% of the population, it's that half of the population are women. And so anybody who's had a period at any point in time has most likely dealt with iron deficiency anemia. Um, and for the most part, I think that's something that people deal with at different points in time. But yes, so anemia is a problem of red blood cells. If you don't have enough red blood cells, that's where you have anemia. So usually we measure hemoglobin. That's the oxygen carrying capacity of the blood. And usually, the more red blood cells you have, the more oxygen carrying capacity that you have. And so, really, when the red blood cells are low for whatever reason, either you're not producing them or you're destroying them too quickly, because red blood cells live about 120 days in the circulation. But if you're not producing enough or you're destroying them too quickly, and then we end up with a situation of anemia where there are not enough red blood cells. And that's why people feel tired because the red blood cells are responsible for delivering oxygen to all parts of the body. And so if you don't have enough red blood cells, then the oxygen delivery is not as great and you can feel really, really tired. And that's one of the biggest side effects, the most common things that happen with anemia is fatigue. But if it gets really bad, you can get really short of breath. Your heart rate can go up. A lot of things can happen as a result of not having enough oxygen delivery to all your tissues.
Great. So yeah, you touched on some of my next question, which is like, what are the symptoms? So it's feeling fatigued, it's feeling short of breath, if it gets really bad. So to break it down further, we're saying that, oxygen is carried by this protein called hemoglobin, and hemoglobin lives in the red blood cells. So if you don't have enough red blood cells, whether because it's being destroyed or it's being lost, like heavy periods, then you're just not going to have enough oxygen carrying capacity, which means you're going to feel tired. You're going to feel short of breath. Okay. So what is the number that we're looking for? Like a normal hemoglobin, we do get our blood drawn. What's the number that we are
For many women,
typically
the
wanting?
magic number is 12, and that's 12 grams of hemoglobin per deciliter. And for men, it's usually 13. And so men do tend to have a higher hemoglobin compared to women. So that's 12 for women. For the most part, if you're higher than 12, you're doing well. Where we really start to see people have signs and symptoms is when we drop really below 10, but it also depends on where you're starting from. And so if you've been 12 for a very long time and you drop quickly, then you'll feel the effects a little faster. But if it takes you time to drop, as in women who've had heavy periods over a long period of time where they haven't gotten enough iron to replace the lost red blood cells, then they can drop pretty low before they really, really start to feel like they're feeling really poorly. But yes, 12 is the number that we like to see with so that patients don't have anemia if they're greater than 12.
Got it. Okay. So say, somebody's feeling tired, they're having heavy periods, they get their blood drawn, the hemoglobin is 9. So it's low, they're feeling fatigued. Now, a lot of patients say, what can I do naturally to improve my blood count? So
I
what
would
would you
say
say to
that
that?
definitely as many things as you can do naturally are important. What are some of the natural things you can do? Number one is really replacing the lost iron. So many times when there's blood loss through periods, you're losing the red blood cells, and so you're losing the iron. How the body reacts usually, and when things are normal, a red blood cell lives about 120 days. And when that red blood cell dies, it's recycled, and the iron content of the red cell goes to make another red blood cell. And so when the red blood cell is lost, then the iron that comes with that red blood cell is lost as well. And so really for especially women who have periods, heavy periods, and they are iron deficient, really it's thinking about what are the iron rich foods that you can eat that will help replace the lost iron. And so definitely we think a lot more about the organ type meats like liver and kidney, and most people don't like that. But
Mm,
honestly, iron is present in so many foods that we eat. I would say it's important to check the labels, and definitely there are two main sources of iron. There's heme iron and there's non-heme iron. And so for those who are vegetarian or vegan, then definitely looking to sources of non-heme iron, which are a lot of vegetables, especially the legumes, have iron in them. But really, you would have to consume quite a bit to make up for the lost iron. I would say one other way is supplements. And so there are iron supplements that are available sometimes over the counter, many times in natural health food stores or in vitamin stores. You can look and consume iron in that way. And that's a way to really get the iron content up as much as possible. But the second piece of that, though, is replacing lost iron is number one. But the second piece is stopping the loss of blood. And so, yes, for many women, periods are a fact of life. But if the periods are very, very heavy, it's really important to work with someone like you, Dr. Cheruba, to figure out how do we address the heavy periods
yeah.
so that we can address both things at the same time, replacing the lost iron, but also preventing the iron from being lost excessively.
That's a great point. Like, what is the source of it? Let's stop the actual problem, not just cover up the symptoms. Sometimes you have to do a little bit of both for a while. Now, let's go back to the supplements. Now, when I go to the like CVS or Walgreens and I walk down that aisle of supplements, I mean, there's so many iron supplements. I get overwhelmed. Like, which one do I pick? There's elemental iron, there's other things, there's ferrous sulfate. So how do we know what iron we should be consuming? Like, how do we know, if your doctor doesn't write you a prescription and we say, okay, just go and get some over-the-counter iron, there's a lot there.
That's a great
What do you
question,
suggest?
Dr. Cheruba. So the one you probably see the most often is ferrous sulfate, which is a good source of iron. However, it's one of those that patients tend to have side effects more often. So what are some of the side effects? A lot of like gastrointestinal type side effects, so stomach discomfort or even abdominal pain or bloating or diarrhea, sometimes even constipation. There are a
Mhm.
lot of side effects that can happen really with any iron. Many times ferrous sulfate is a drug that gives you more side effects. Ferrous gluconate is another formulation of iron that people do tend to tolerate a little bit more. And really, I would say that look for all types of iron that are not in the sulfate formulation. So if it's not ferrous sulfate, it could be ferrous gluconate, it could be ferrous fumarate, could be ferrous still biogluconate. There are a couple of different options. But I would say that for each individual person, it's likely to change and differ as far as which which formulations you tolerate the best. So I would say that buy a little bit of something. You can start with ferrous gluconate and see if you tolerate it. And if you don't, then move on to the next agent and see how you tolerate that as well. And I will say that it is worth going through and finding which iron works best for your system because it's really, really important that you keep ahead of the losses. And so sometimes what happens is people say, I can't tolerate it. I can't stand the iron. I'm not doing it anymore. And then they don't really give iron supplements a fair chance. That being said, there are some patients who cannot tolerate iron at all. And for those patients, we do think about giving them iron through the IV. I know that's not a natural way to give iron, but it's one way that we consider it, especially for patients who've tried and have not been able to get it in with supplements.
That is so great. When I trained, we were always taught to do ferrous sulfate. And so, that's just kind of what I've known. But as I said, like when you go to the supplement aisle, I'm like, what do I pick? There's so many types. So this is such a great point. And I know patients are also often overwhelmed, like which iron do I pick? And so I'm glad you went through the different forms and which ones are better tolerated. So thank you for that. Now I know when you take supplements, as you said, like try a few different ones because you really have to stick with it, right? Like you take it 2 or 3 times a day. You really got to be very consistent about it for a month or more to start seeing any effects. Now in residency, we also did vitamin C along with it because, for better absorption. So do you recommend like a vitamin C supplement or maybe just drinking some orange
That's a great
juice? What do you
question.
suggest?
So yes, over time we've learned a lot more about iron supplements. So one thing we've learned, actually we've always known, is that they can be hard to take. And so in the past we would ask people to
Mm,
take it 2 or 3 times a day. But now more and more we're finding out that less is actually more. And so now we're actually recommending that patients go to taking it once a day or maybe even every other day because it does increase absorption and it also increases people's chances of sticking with it. So we're saying now taking the iron supplement about once a day or maybe once every other day. The second thing is exactly as you talked about. Yes, you need vitamin C. Vitamin C helps to improve the absorption of the iron. And so either you can do that with a vitamin C supplement at the same time as you take the iron, or you can do that with orange juice or with apple juice or any of the juices that are high in vitamin C content. And so definitely, I think the juices make sense because it's like you're drinking juice and you're having the iron at the same time. So definitely do that to increase absorption. Now, does it mean that if you don't take vitamin C, you can't absorb the iron? You do, but there's a greater extent of absorption with the vitamin C, and so it's definitely
mm.
recommended.
That's great. I learned something right now. I didn't know that the recommendation now was once a day, because we used to write it 3 times a day with the vitamin C, and I know it was a lot to take 3 times a day, and those are big pills, and then people just won't take it. So that's great that it's once a day. Do we take it first thing in the morning, like on an empty stomach? Do you recommend it with
Yeah,
food?
so some of the medicines that or some of the foods that we eat, especially calcium containing foods, can sometimes interfere with the iron absorption. So it's really good to take it like
Mm,
away from food. And so either before you have something else to eat or
yeah,
about 2 hours after you've had other food items. So yes. So it's important to you can take it first thing in the
got it.
morning, but
Okay,
sometimes people do like to have something in the stomach. And so maybe about 2 hours after you've had breakfast makes sense.
2 hours. Okay. Great. Such valuable information. So before we wrap up, I do want to talk about IV iron because as you mentioned, that is sometimes a better way of getting it for people who can't tolerate oral iron. And in my practice, I do that a lot for patients. So I'm trying to get ready for surgery. I'm like, okay, we don't really have time to be taking this oral iron for a couple months. Your surgery is coming up in a few weeks. We need to kind of give you a rapid bolus of IV iron. So that is iron through an IV that you can get as an outpatient, right? And how long does it take for the iron to go in, and how quickly
Really,
can you see the
really great
results?
question. So, there are different kinds of IV iron formulations as well. And so, some of the examples of so there's iron first, iron sucrose, and there's iron, different kinds of iron. I don't want to go through all of them, but really, your doctor and you can talk about which iron is best for you.
Yeah.
Some of them, so one of them actually is it takes all day iron dextran. It's like a 4 hour infusion at least. So it can be an all day activity, but you
Mm,
do get a lot of iron in that 4 hour infusion, as opposed to something like ferric gluconate, which you get a little bit each day. And over a couple of days, and you can get your fill of the iron. Iron sucrose is another version where we can give a little bit each time over a couple of days. So it kind of depends on how much time you have to invest if you're able to come back a few days at a time and it's in terms of getting all the iron that you need. Because usually what we'll do is we'll look at what your hemoglobin is, We'll calculate how much iron you're missing, and then
Yeah.
we'll figure out the dose, the right dose for you. And sometimes that has to do with which medicines are available and sometimes which are covered by your insurance as well.
Yeah.
And so as far as how quickly it works, really it's a matter of days. We start to see your red blood cell
That's
production
great. Yeah.
kick in, and the numbers start to improve after that. So definitely it's just a matter of days to see the improvement.
Days. That's great. And so in my practice, I mean, that's where I refer to a hematologist. I don't, I discuss IV iron a little bit, but I don't know all the ins and outs and what formulation and everything. So that's when I refer patients to hematologists. They kind of sit down for a consult, go through that whole treatment and get them scheduled. So for those watching, that's when you would kind of move your care, or in addition to your gynecologist, you want to be working with a hematologist to talk about, IV iron. Now we have a question from Amina. Hi, Amina. She asks, can anemia be reversed? Once diagnosed, will I have to take iron for the rest of my life, even if my blood levels improve, or only if my blood levels remain low
What a
within the
great
anemic
question,
range?
Amina, and thank you for asking it. So one thing that's important to note is that there are different reasons for anemia. Iron deficiency is one of the more common reasons for anemia, especially in women who have periods, but it's not the only reason for anemia. So I think one of the most important things is definitely to talk to your doctor about what is the cause of your anemia. If iron is the cause, then absolutely it is a reversible cause. So there are two reasons why you don't have enough iron on board. Either you're losing blood and you're losing the iron with it, or you're not absorbing the iron, or you're not eating enough iron. So I guess that's three reasons. And so if you have excessive periods, it's important to work with your doctor, like Dr. Cheruba, to figure out how do we minimize the loss of blood. That's an important component, because if you can minimize the loss of blood, then you might not need iron long term. You just need to replace that which was lost. And then as far as if you're having trouble absorbing iron, then you might need to have IV iron infusions over time until you stop losing blood through menstrual blood losses. But if you are not eating enough iron in your diet, then that's just something that you can work on to get more iron in your diet. So hopefully you shouldn't need iron forever, if you can address the source of blood loss or maintain a healthy intake of iron.
Yeah. That's a great answer, and that's a great question. And as you mentioned, there are other reasons for anemia too, right? It's just not blood loss. As a gynecologist, that's what I see the most. And patients with fibroids, especially bleeding a lot, but there can be other genetic causes for anemia, different, thalassemias, depending on which part of the world you're from, right? That can be a reason. And then also for women, postmenopausal and older women, if you're having tarry stools, if you're having black stools, that could be another symptom and sign of blood loss, and leading to anemia that needs very prompt evaluation by a colonoscopy. So something to keep in mind for kind of other sources and reasons for anemia. It's just not vaginal bleeding, but there can be genetic reasons, other you could be bleeding elsewhere, and that could be causing anemia as well. Do you have anything else to
Yes, I
add
would
along
say
that?
definitely sometimes we're not sure if it's iron deficiency or if it's another cause of anemia. I would say if you've given iron a chance and you're still having anemia, it's definitely worth talking to your doctor about what else might it
Mhm.
be other than iron deficiency.
Yes. Yes, yes, because I think this is something that happens. People are like, oh, well, I'm getting taking iron supplements, and they're sort of ignoring other reasons why they could be anemic. So really seeing your physician and really talking to them about all the other possibilities that could also be going on is very critical. So well, thank you so much. This was, I mean, I learned stuff in this session. So thank you so much for coming on and talking to us about anemia, the treatments, supplements. We talked about IV iron, other reasons for anemia, what else to look for. So this was really highly valuable. Thank you so much for your time, Dr. Toyosi. Really appreciate it. If you guys are watching this at a later time, please type in hashtag replay. Let me know if you have any other questions. Dr. Toyosi, where do you practice? Where can people find you and work
Absolutely.
with you?
So I am at Duke University Hospital in Durham, North Carolina. And if any patients want to connect with a hematologist, definitely you can find us, me and my group there. It's a large academic practice, and I mostly see patients in the hospital. And so chances are that if you are wanting to be seen, you'll see one of my colleagues who sees patients in the outpatient. But I'm always happy to help by answering questions that docs may have on behalf of their patients, because that's primarily how I practice, is really supporting docs as they care for their patients with hematologic disorders.
Yeah. Oh, wonderful. Thank you so much. And if you're watching, as I mentioned, I'm Dr. Prabakar, the Fibroid Doc, and I am based in the San Francisco Bay Area. So you can find me here in Lafayette, California. If you're somebody with fibroids and having bleeding and just have questions about fibroids and fibroid management, you can also sign up for fibroid coaching by emailing me at thefibroiddoc@gmail.com. So thank you all for coming on and spending a little bit of your lunch hour with us. And have a great day, Dr. Toyosi, and everybody
Thank you
else.
for
And we'll see
having
you
me.
later. All right. Bye.